All right, Jen. So you've been here since 1975,
Correct, November 1st.
November 1st. And what was it originally that brought you to NVRH?
Well, I'm from the community, went to high school and graduated in St. Johnsbury Academy and wanted to work here, but actually it's amazing as it seems at this time, they weren't hiring full-time that summer, so I worked somewhere else. And I started in November to take the ICU class to work in the special care unit.
So did you start out in the ICU?
Yes, nights.
And then eventually you were med-surg?
I worked, then I have a long list of things I've done here. It'd be easier to say what I haven't, but I worked in the ICU, became the nurse manager of the ICU, was day supervisor for a while, did quality for a while, was the nurse manager of second floor for many years, and now I'm the full-time office float nurse.
Okay. So when you first started working, so you were very close to the beginning, 75, and it opened in 72.
Correct.
So what was the feel of the place? I mean, it was fairly new. What was the feel of the place when you
Well, it was
came?
nice, and I started working in the ICU, special care unit as it was called, and I started working with Alice Player and Chris Douglas, who for years told the story of the first patient was admitted on Valentine's Day to the ICU or special care unit. So that I lived with that. And when I actually started was when, at that time, they had just remodeled, even though it was that old, and made the ICU, instead of 4 beds, it was 7 beds. It was the 4 beds it was now, and then where now is inpatient PT, it was the ICU, and they had 3 beds for ICU, so they went from a 4 to.
And what is it about NVRH that kept you here for your whole career?
I think the opportunity, I think sometimes people think small is not as good, but I've found we're always really progressive. It's very supportive of individuals' ability to rise and learn, and for me personally it did, and for people, almost everyone. I think if people want to, there's lots of opportunities, and the people who work here, we've been cutting edge on so many ways, even though we're small. And I remember going to Burlington one time and with people from the medical center, and someone said, "Aren't you intimidated?" I said, "No, just listen. You will see that we're right up there, if not beyond them."
And what are some special memories that stand out for you?
Well, when the hospital first built, it was, the 3rd floor was the surgical floor. So there was, 2nd floor was medical and the ICU, and the 3rd floor was surgical patients. So what I do remember was one July, and it was a 100-bed hospital. The most patients I ever remember being here were, there were 96 patients, and it was in July, which is not usually our busy time, but it was. I think the only place that was not full was the birth center. So, and the other thing that stands out personally for me is I was here and actually was involved the first time they gave what they call clot blusters, thrombolytics, to a patient who was having a heart attack in the ICU. And I remember Dr. Thompson said, "Jan, you will see this, it will change the world," and it has. So that was really kind of nice for me.
Yeah.
But I think what most touches my mind is all the people I've worked with, all the excellent doctors, nurses, the healthcare, everybody, the housekeepers, everyone who keeps this place afloat. And what I've appreciated is that as an organization, it doesn't matter what you do here, we all contribute to that. And you can be this CEO, and you can be the lowest paying job, and we're all just as important. And I think we're all invested in giving the patients the best thing and individual growth for all the employees. And that's what really stands out in my mind.
And I haven't been here as long as you, but I do remember the flood on the 2nd floor.
Oh, yes, which was pretty, yes, I forgot about that, yes. When you get a call at home and they said they just dumped 5,000 gallons on the 2nd floor, and you come in, and as I was heading out the door to go to the hospital, my husband says, "Don't you think you ought to put boots on?" And which, when I showed up and the supervisor said, "How did you have boots on?" And that was why I was grateful. And I came with chocolate. But and it was interesting because one of our patients' daughters worked for Channel 3 News, and we made the Channel 3 News because once the flood hit, they stopped and people couldn't leave the floor, so she was in there with her cell phone videotaping, and we were on the news at 11 o'clock, and I think I got here about like 8:30, so.
And what created the flood?
A water pipe a valve broke over the kitchen. And the staff, they just rallied, they managed to, patients and visitors were keeping the floor, you know, the water away from rooms. It was pretty interesting. That was probably one of the most memorable things. And the first day the helicopter landed here, when they started DART, that was a big thing. It's been interesting. And when you ask about, we still feel new. We're always changing, and it really is. I think sometimes when people come here, they don't realize how old it is. Because we try to keep it fresh, and the nature of patient services has changed so much. You have to evolve to do that, and I think that's one of our biggest strengths.
Great. Anything else that you want to mention?
No, I think as a nurse, I've always been touched that it's our patients in our community. And I had this one patient I cared for early in my years, and every time she came into the hospital, she would always ask for me. Mm-hmm. And I think it's those things that touch you, that the people you care for, the people you run into in the grocery store. My family's been cared for here, and one year I had family that were in 4 different institutions across the country, and the best care was the care that was given here. And I'm proud of that.
Yeah, nice. All right, thank you.